Over the past 10 years, we have seen statements by the government and the cabinet and Prime Minister Dr. Mustafa Madbouli saying that we have invested and we have pumped as a state about 4.9 trillion Egyptian pounds in the mega national projects in general. Yeah. How do you think this has affected the health sector in a positive way? As before the break, you've mentioned, for example, the digitalization of the information and the data for the benefit of the citizens.
Okay, so all the time and in most talks we were faced that if you invest in healthcare, you are investing in a consumable industry. Yes. We just consume money, we just consume resources, and there is no measurable returns. That's actually very incorrect and was proven incorrect by the Prime Minister and the administration, because every pound you are investing in healthcare, it got a lot of return on investment. In a very nice study, they measured that every dollar you are spending in healthcare, you got a $3 return on investment. So in mega projects, investing in healthcare, it's a very important pillar in the improvement. Another sector is, it's not a consumable ministry or industry, it's actually productive. It produces the most important product in any country. It produces health. Yes. If you do have a good health, you do have a good economy. If you do have poor health, you're not going to be having a good economy. And we do have COVID as a witness for that. Most of the people were actually off work. There is no productivity. And we've seen that the world lost in 1 year around 1.5 trillion US dollars just from the productivity lost. Just productivity lost. Not mentioning...
Not treating the patients.
Not mentioning the treatment, the vaccination, all of this. So it's very important that currently we are focusing, and then the previous 10 years we launched a lot of mega projects. The Universal Health Coverage project is one of them. It's a mega one. And we do have a lot of hospital built. We do have a lot of authorities. And we can say that all of these are under a big umbrella called health governance, having all authorities, the new authorities built, all the authorities built together in digitalization, having them in automation to make sure that, for example, if we are procuring any medication, the patient will receive it in a timely manner. We're not making governance to make the turnaround time for patient elongated. We would like to have it shortened. To make sure that we are having that, we need a mega digitalization for the system. We need a mega automation. And to make sure that the governance is actually done in a timely manner.
Yes, Doctor, you have mentioned before the break as well the elimination of hepatitis C here in the country, according to one of the presidential initiatives by President Abdel Fattah al-Sisi. And one of the statistics says that we have the infection rate decreased between 2015 and 2021 between 14.7 to under 1%. Yes. That's quite an achievement for Egypt and for any other country in the world. What does this say about the priority of health for the state, about the determination of the political leadership to be having health upon top of the agenda for itself?
So first, it is a success story. Yes. And a lot of stars from the ministry and all from the other ministries as well do have the public health and the public health initiatives administration inside the Ministry of Health, for example, a lot of achievement, because you would like to launch a program that will reach 50 million citizens. Yes. It's not an easy one. That's, again, a Guinness record screening number. Yes. No other country achieved to screen 50 million citizens. Another thing is how you're going to make sure that the citizens will have the confidence to go to the health facilities and the primary units to make their actually screening. And hence another success for all the peripheral units who are actually encouraged in the primary care units, citizens to come and make their screening. Another one is statistics. Yes. How you make sure that every single contact with citizens are recorded, and there's a central digitalization system that records everything and making sure that the positive results are there positive, a true positive, not a true or a false negative or a false positive. And then how are you going to refer all these patients detected, and we detected 2.5 million, to tertiary units to get their treatment. And then another success story is the treatment used to be a very expensive treatment. Before, in 2015, for example, it was 120,000 Egyptian pounds. Yes. Currently, it's 3,000. So we achieved a very good deal. Again, localization for the medications, technology transfer from the multinational companies to Egypt, And currently, we are manufacturing all the hepatitis C medications. And hence, we have a very good traffic for medical tourism, hepatitis C patients coming from England, for example, and from the Gulf to get their treatment here because it's much, much cheaper. It's of high quality, and they can do their touristic side as well, besides getting their treatment. Another thing is how you make sure that you're not going to be having a reinfection. So you need to focus on the public health, on the hygiene techniques, on the hygiene of the Egyptian citizens, and making a lot of public awareness campaigns. And hence, and because of that, last October, after the screening, we made sure that we do have a less than 1%. We are on our way to eliminate it to 0%, and hence we got the golden tier in our road of elimination of virus C by the WHO.